Elyssa is currently a PhD candidate at the University of Georgia School of Social Work and a fellow at the Center on Human Trafficking Research and Outreach, looking at gender-based violence, complex trauma, and survivor-driven interventions. Over to you, Elyssa.
Great, thank you so much. Let me share my screen. Okay, so just like Jesse mentioned, my presentation is on my project that was really about using collective data analysis to improving evidence for policy and practice for child labor trafficking survivors in Sierra Leone. So I'm going to break down what that actually meant and some of the key findings from that study. So one study found that the 1-year prevalence rate of child trafficking in the eastern province of Sierra Leone is about 33%. And what a baseline report by the African Program for Research and Intervention to End Slavery, or APRES, found was that this practice of child fostering, or menpekeen, was one of the main ways that the child trafficking in the country was being facilitated. That doesn't mean that child fostering always leads to trafficking, and that's not a really helpful cultural practice for many, many children. It's just that there is a big proportion of trafficking survivors who were kind of filtrated through this practice. And this practice really hinges on the fact that in rural areas, there's lack of access to education, often many children to feed with lack of resources. And so in times, some of the children go and live with relatives or family friends in bigger cities, usually, and go to school. So little information about supportive services for child labor trafficking exists, especially in the Western African context. And really that what this project and other subsequent projects are looking at is what best serves survivors and also how it best serves survivors. So this research study was really carried out in deep partnership with World Hope International and their Sierra Leone program focusing on child trafficking. It's one of the programs they have in country. It's been around since 2004, and then their recovery center, which is the shelter that I'll be talking about, opened in 2012. So this is really a study-based and community-based participatory research, or participatory action research. This project is kind of part of a larger project from APRES and Center, the Center on Human Trafficking Research and Outreach, that I'm involved with. And through those meetings, there was the need identified by staff at WHI that stronger assessment tools, or more particular assessment tools, were needed to actually give them the information to change the program based on the survivors they were seeing within the program. So the need was actually brought about by the staff, and then this project was kind of created in conjunction with the staff. So the first step of this process was a quantitative analysis of 4 years of client data. So we have client files. If you've ever been part of a project, you know that wherever there are services, there's usually a lot of paperwork. And so what we were seeing is intake forms that had descriptive data, qualitative data about what had happened to them in their trafficking experience. And most kind of curiosity around was the clinical care assessment tool, where assessments were kind of put at 3 different points in time. So at the beginning of their stay in services, the midpoint, and then at the end point. On this tool that was developed internally by WHI that really tried to capture outcomes on 6 different subscales, which were trauma, anxiety and depression, pro-social behavior, hostility, and spirituality. So after this analysis, the plan was to kind of incorporate all of these findings, have a feedback session with staff and whoever other stakeholders were involved, and really talk through the utility and the usefulness of assessment tools. So using that data, that quantitative data, to really inform the next level of assessment tool development, which then led to partnering and a redesign of their assessment tools, which is still ongoing. So at the first section is really talking about the case file analysis. So what did we find in these case files? And like I mentioned before, we had intake forms, which had a lot of incredible data around kind of violence experienced during trafficking, what type of trafficking, forced fraud or coercion within the trafficking. And so you can see some of the descriptors of survivors here. I do want to point out that it is a majority female population, and usually the survivors' ages were between 5 and 18. So the only minors are served at the WHI program. And they serve survivors in two different ways. That the Recovery Center, which is a shelter based in Freetown, the capital city of Sierra Leone, and also in community support through social workers and kind of case managers that are out in the community in kind of more rural provinces. Also, they generally put male children at partner shelters and only allow female children in the recovery center. And so you can see we'll be talking a little bit more about that difference in just a minute. You can see that most of the survivors were from Sierra Leone. Several were from a neighboring country, Guinea. And there are also the internal trafficking, so children trafficked just in Sierra Leone was 70%, while external trafficking or trafficking outside of the country was around 30%. Just reiterating some findings that Holly shared, death of a parent and death of both parents was definitely a vulnerability factor. You can see that 57% of these survivors were a part of the cultural practice of Mempikin, and several had also run away. So there were several different kinds of data analysis that were kind of used on this study, but I want to really just stick to the highlights. What we found was that the midpoint scores of different survivors were linked to the final scoring. So in practical use terms, as you can predict how the trajectory of a survivor is going from their midpoint scores and use that information to really kind of wrap around the child in more services if needed. Controlling for all other variables, female children scored 21 points lower, which means better outcomes than male children. And one of the reasons that could be is because the female children were being served in the recovery center that is the only human trafficking specific shelter in the country. And it's also trauma informed, and the staff have lots of training on how to deal with different trauma responses that might arise. Male children are put at partner shelters that might not have those same amenities and are usually utilized for homeless youth. Notably, a trafficker who's a family member predicted worse scores at midpoint, which, thinking about the really difficult relationships that could have between a family member or a family friend, and then trying to make pro-social connections while outside of trafficking, you can kind of imagine that trust and different kind of social interactions might be weighted by that experience. Okay, so the next phase of the project is really the collaborative feedback. And so these are pictures from an in-person meeting held in Freetown in March of 2022. All of these pictures were taken and shared with permission of everyone pictured. And what we did was really trying to get at not just the kind of surface level feedback of the assessment tools, but really how are the staff implementing these, which can often be very different than what their intent of implementation was. And then also, how useful do they find this information, or how does this information captured on the tools actually translate into policy and practice? So we had an interactive activity where each person present, which included the shelter director, social workers, counselors, and house parents, had a copy of all of the relevant assessment forms to get individual feedback. They were given different kind of pens, so a yellow highlighter for something that is working well, a red pen to circle things that are not working, blue to work things that say they're working sometimes, but they might need some changes to work better, and then a black pen for notes. And as you can see here, it was a very interactive process. People got to individually mark things if they weren't comfortable sharing out loud. And then after all the individual kind of feedback, we did have a group session where we talked through all the different kind of recommendations that they had and just the context for how the information is used. So after that activity, there were a lot of great information that came out of that. The three main recommendation types that were really highlighted were the practical utility. The three main recommendation types were practical utility, how to make this easier on staff. We know that when things are easier for staff and they're clearer, that actually helps collect data that is more accurate and more useful. Trauma informed, so seeing everything through the lens that a survivor might see it through. And then also just the ease of data collection. So really looking at how is the information being transferred to the administrative team? How is it being reported? How are these kind of things being reported to policymakers, funders, the general public? And so when thinking about these different levels, just an example of what would a survivor-centered recommendation look like. For instance, on one of the CCAT scales, they have the question, do you disobey your parents or caregivers? And so the higher the score, the worse the outcome. Yet sometimes to cope with different things around their trafficking experience, they might have disobeyed. And that could actually be seen as a strength in that situation. And so really kind of critically looking at not just what it says and what it measures, but how will it impact and what would the actual impact on a survivor be and how would they answer. So you can see that the different recommendation themes were sorted by recommendation and recommendation source. As a follow-up to this, we had more feedback meetings where we actually were working on the tools together with Centro staff, WHI staff, both in Sierra Leone and based in the United States, and myself. The Recovery Center staff were also present so that we could all get on the same page and that the recommendations were just that, they were recommendations, and that they would actually have ownership, WHI would have ownership of any changes made themselves. So those are references, and here's my contact information. I would love to talk to anybody about this research, and a huge thank you to the RTA team, World Hope International, specifically Haley Clark and Miriam Fulla, and then the Center on Human Trafficking Research and Outreach.
Thanks so much, Elyssa. I think that really highlights the value of sometimes non-traditional forms of data, like NGO intake forms, which is something that a lot of teams are exploring. So thank you for that.